PowerPoint presentation for my Communications 1, ENL 1813S.
That's
And
you.
now let's begin. Good afternoon and welcome. Thank you for having me. My name is Amanda and I'm here today to talk to you about personal support work and the role of a personal support worker. Now before I begin, if anyone has any questions, please feel free to ask and I will answer them as I go. Now, what is the role of a personal support worker? A personal support worker is an unregulated healthcare professional responsible for assisting clients, residents, and patients with activities of daily living, which are ADLs. ADLs are tasks that we would perform on a daily basis, such as brushing our teeth, getting dressed, meal preparation, toileting, bathing, eating, and even walking. A personal support worker, also known as a PSW, provides compassionate care by treating clients and their families with respect, kindness, and understanding, caring about their suffering and misfortune, and having concern for their overall dignity, independence, preference, privacy, and safety, therefore improving the quality of life of the client and their family. Where would a PSW find employment? There are many employment opportunities out there for PSWs, both within facility-based environments and within the community. Long-term care facilities and nursing homes are examples of facilities, and they offer 24-hour nursing care services to residents who are not able to live independently on their own, but do not require hospital care. Another example would be in hospitals. A hospital is considered a facility. You'd be working with patients who had just had surgery, who need palliative care, those who suffer from acute or long-term illnesses. Now, within the community, there are retirement residences. Most of the people in there are older adults who don't necessarily have an underlying condition that would put them in there, and they're usually pretty independent and need little assistance with their ADLs. In group homes, you could be working with teaching the residents basic skills such as cooking or shopping so that they can live independently one day on their own, so you will be there preparing them. Now, in the homes of the clients, that is another example of working within the community. You could be employed through an agency or privately. You may be hired privately as a companion for an older adult to assist with the activities of daily living, performing light housework duties. Basically, you're there to relieve the primary caregiver if there is one. Now, who does PSW care for? PSW provides care for a variety of people, and depending if you're employed in a facility or in a community, you may have a variety of clients who vary in age, such as those older adults. Usually older adults, it's just they need assistance as they age. People with disabilities, such as those who are paralyzed, those with medical issues, such as cancer, those who suffer from mental health issues, such as dementia, people who require special care, mothers with newborns, so a woman who, say, had a C-section and has no support system at home may require care from a personal support worker. People needing rehabilitation, so someone who has recently suffered from a stroke may need assistance. Those who have had surgery for whatever reason, as well as children. Now, the children could either be the children of those who suffer with mental health or who have disabilities, those with medical issues or requiring special care or rehabilitation, or the child themselves could be the client. Now, responsibilities of a personal support worker. A personal support worker has many responsibilities. First of all, working within your scope of practice, and which is knowing and working within the legal limits and the extent of the healthcare worker's role. Next would be to observe and report any changes to the client to to the nurse in charge, whether those changes are for the good or for the not so good. So, for example, a change for the good would be Mr. Smith, who could not take any steps last week on his own, is able to take 3 steps to his wheelchair assisted by you today. That would be an improvement. Therefore, you would note that in his chart or on the record and report it to the nurse. A PSW is also responsible for personal care, support for nurses and the healthcare professionals, family support, social support, light housekeeping, and home management. Now, for personal care, you would be responsible for like the overall bathing and grooming, toileting, dressing, eating, and assisting those with limited mobilities. For support for nurses and other healthcare professionals, you could be assisting with cleaning the equipment, measuring and reporting vitals, assisting with minor wound care, assisting with oxygen therapy or heat and cold compresses and range of motion exercises. Next would be family support. In family support in facilities, you may assist with admissions and discharges, introducing the family and the client to the facility itself, assisting with unpacking in a private room, as you help care for the client with themselves with their ADLs, light housework, meal preparation, and even relieving the primary caregiver, giving them a break, letting them go out while you take care of that portion of the day. For social support, it would be helping the client participate in social activities or hobbies, or functions, teaching basic skills to help them live independently on their own. Then there's light housekeeping and home management. The terms will vary depending if you're in a facility or in the community. And it really just depends on your work setting on what you would be doing. The general task would be making beds. So when a client or resident gets up in the morning or a patient, you may make their bed. When they're discharged, you take everything off, disinfect it, or remake it for the next available person. Minor home management, so assisting with laundry or, wiping down the counters, getting the dishes in the dishwasher or washing them by hand.
Yeah.
However, when it comes to light housekeeping and home management, you must always consider the client's care first. Say if the client is incontinent, you would obviously stop what you're doing and assist them with that first, because the overall health and well-being of the client comes before housework. Housework in general, you are usually only responsible for assisting with the minor little things, and if more is needed, then you would report that to the social worker involved or whoever is involved, such as if they don't have a social worker but they have a family member in charge, you would report that to them so that they can check and see if they qualify or if they can hire someone to come in and keep up with housework for them. Overall, being a personal support worker can be very rewarding. You get to help others and you get to ensure that they are safe and well cared for. And your ultimate goal is to improve the quality of life for the client as well as their family. And by knowing and working within your scope of practice and promoting their dignity, by promoting dignity, you would say ensure that they were covered in only the necessary parts exposed for, say, a sponge bath. Independence. If you know that they can put on their jacket on their own, allow them to do that. Give them the extra time so that they can build their confidence. That gives them independence. For preference, giving them a choice, holding up 2 sweaters and saying, which one would you like to wear today, instead of picking something and putting it on them. For privacy, not discussing their condition or what they did today out in the hall openly where everyone can hear, keeping it between who needs to know. such as you reporting to the nurse, but doing so discreetly so that not to cause any embarrassment, as often people who do require care do feel. And for their safety, not leaving them alone in the bathtub, putting up the rails if they require a bed rail before, making sure you lower the bed when you're done doing what you have to do. Now, thank you very much for having me here, and if you have any questions, please feel free to come up and ask me. You can also email me at any time. My email address is on the handout. Thank you very much.